You may be wondering to yourself, where did the time go? You probably remember your first day of work like it was yesterday. Your introduction to government acronyms was probably in your orientation class when you heard words like FEHB, FEHBA, SIRS, and FERS, and now you're listening to a pre-retirement seminar. You're likely here because you're in the planning stages of retirement, either getting ready to retire in a few short months or just starting to think about retirement down the road. As a public servant, you have dedicated your working life to help make this great country of ours a stronger one for the future. So, now it's time to start thinking and planning for your future. One of the first places you'll want to start is the OPM website. Here you'll find one of the most helpful resources for your planning, the Pre-Retirement Timeline tabs. Under the Retirement drop-down menu, click on the retirement system that applies to you. On the left-hand side of the next page, you'll see the Planning and Applying link. This will take you to the timelines from 5 years or less to within months of retirement. Each of these pages contains a checklist of actions you should be taking at that stage in your pre-retirement planning. You'll also want to use the Retirement Income Calculator tools to help you estimate your total income once you retire. Another great resource is the Frequently Asked Questions link, also available under the Retirement tab on the OPM homepage. The FAQ pages have hundreds of common and not so common questions that may pertain to your specific situation. They're broken down into 3 categories: pre-retirement, post-retirement, and leaving the government. Many of the questions pertain to health benefits in retirement, and that will be our focus today. One of the most important benefits you've earned as a federal employee is the ability to take your health plan with you after you retire, without having to increase your portion of the total premium. In retirement, the government continues to pay over 70% of you and your survivor annuitants' monthly premium. Your share of the total premium will be deducted every month from your annuity. First, let's go over some retirement ground rules with the Federal Employees Health Benefits Program, known as FEHB or FEHBA. In order to qualify for coverage after retirement, you must be continuously enrolled in any FEHBA plan for 5 years before retirement, commonly known as the 5-year rule. The rule does not require you to be enrolled in the same carrier during those 5 years. The 5 years can include time you are covered as a family member under another person's FEHBA enrollment, or time covered under TRICARE or CHAMPUS as long as you were covered under a FEHBA plan at the time of your retirement. The Federal Employee Dental and Vision Insurance Program, or FEHBP, does not have the same 5-year requirement. You can enroll in a FEHBP dental or vision plan for the first time as a retiree, even if you were never enrolled as an employee, as long as you have an immediate annuity. Okay, let's get back to the ground rules. If you cancel your FEHBA coverage after you retire, you will not be permitted to re-enroll at a later date. You do, however, have the option after you retire to suspend your FEHBA coverage if you join a Medicare Advantage plan or TRICARE in place of your FEHBA coverage. When you suspend your coverage, you may re-enroll during the FEHBA annual open enrollment period, unless you involuntarily lose your Medicare Advantage plan or move out of the plan's service area. After you retire, you may find that your health plan doesn't suit your specific needs any longer, or your family status may have changed. As a federal retiree, you have the same ability as an active employee to make changes to your health coverage. Instead of using Employee Express or your agency's designated payroll system, most retirees will use OPM's online services website for administering retirement benefits. OPM also offers a dedicated website during open season to make health plan changes for the upcoming year. Some agencies handle retiree benefits themselves, so you'll want to contact them directly. You can also make changes to your enrollment outside of open season for some qualifying life events. One event people are surprised to find out is not a qualifying life event is retirement. Retirement does not allow for plan changes outside of open season. Another thing some people are not usually clear on is whether family coverage is required at retirement. In fact, you are allowed to add a spouse or qualified dependents in retirement. Which takes us to survivorship benefits, Another great benefit of federal retirement. Survivorship benefits allow for your survivor annuitant to continue FEHB coverage after your death. There are some important rules to follow here as well. You must be enrolled in a family plan at the time of your death, and at least one family member must be entitled to an annuity as a survivor. If you do not provide for a monthly benefit after your death, your survivor will not be able to continue coverage under the FEHB program. To make certain your survivor annuity information is accurate, you'll want to schedule a visit with your personnel representative who can review your official personnel folder, or OPF, with you. It's a good idea to review your OPF 5 years prior to and 1 year prior to retirement to make sure all your records are complete and accurate. You should verify all your service and make sure your insurance coverage is documented. You can also review your election opportunities to provide benefits after your death to your spouse, ex-spouse, or another person you designate as having an insurable interest in your continuing life. We've discussed some of the more important FEHB regulations in retirement. To learn about Medicare Parts A through D and how they work with the FEHB program, you'll want to watch our other videos on youtube.com/GEHA Health. We address the most popular question among federal employees and retirees turning 65, should I enroll in Part B or not? You'll also find a short video on how GEHA health plans work with Medicare in retirement and how our FEHBP dental plan can help reduce your dental expenses. You can also find us on Facebook, Twitter, and Pinterest, where you can discover great recipe books, healthy lifestyle advice, and updates on your federal health benefits. Your days of learning new government acronyms will be coming to an end soon, and you'll be starting a new chapter in your life. We wish you happiness and good health in your retirement, and we thank you for your many years of public service. Have a great retirement.